Hi, my name is Dr. Patience Daniels, and this is my ethical dilemma presentation on to disclose or not to disclose. That is the question. Currently, I'm an assistant professor of criminology and criminal justice at the University of Alabama. Additionally, I serve as the advisor to three organizations on campus: Alpha Phi Sigma, the National Criminal Justice Honor Society, Zeta Phi Beta, Sorority Incorporated, and the UA NAACP. Additionally, I'm an adjunct professor for criminal justice at Lane College in Memphis, Tennessee, and I've been married to my best friend and husband, Willie Daniels, for 11 years, and together we have two daughters, Annalise and Aaron. We are active members of our church, Greater Faith, and I serve as the assistant youth director. I am pursuing this degree in hopes of one day opening my own counseling practice entitled Patience and Prayer. On this slide, I will have my presentation link. And so the ethical dilemma, the link to the Pearson education video to self-disclose or not is located in learning module number 4 in the course shell. And the hyperlink is located in my notes. But David is the client. He has a substance abuse problem with drugs and alcohol, and he has been seen by several other counselors regarding his situation. But he has a hard time connecting with them. He feels as though no one understands him or the things that he is going through. So therefore, he reached out to John, who is now his counselor, and he has asked him, has he personally dealt with any addiction? John disclosed to David that he has dealt with clients with similar issues to his, and John also disclosed to David that he is in recovery himself. So there are two problems, one ethical, dealing with self-disclosure, and the other professional, dealing with client-focused issues. So while it is not unethical for John to disclose to David that he has been in recovery for a while, it can be a violation of the ACA Code of Ethics if the disclosure is not properly relayed. This will be discussed later in the presentation. However, according to Bray's 2019 article, counselors who choose to self-disclose information about their personal lives in a therapeutic session often use it as a tool to connect to their clients. Self-disclosure provides the counselor with an opportunity to build rapport, increase trust, and express empathy with the client as they move toward the treatment goal. When the client forms a connection with their counselor, it fosters a sense of closeness, allowing for engaging sessions. The client will feel seen, heard, and understood. Regarding professionalism and self-disclosure, John informed David that he would be able to help him with his issues based on his training rather than his experience. This is very important as the focus must remain on the client. While John may disclose some personal information and offer techniques that could help him with his recovery, his personal information, thoughts, and beliefs should be planned in advance and be given to David in a limited way. John, the counselor, should control the amount, frequency, and the depth in which he discloses information. So self-disclosure can be very tricky because when it comes down to it, it's about making a good judgment call. There are times when self-disclosure is appropriate, and then there are times when it is not. When sharing an experience, the counselor should only disclose enough information about the event. There is no need to go into specific detail to what you did with a similar experience. When the counselor provides too much information about themselves, it starts to become more about them than about the client, and then the focus has shift, and this is when it becomes unethical. So there are ACA standards and state codes that apply to John and David's scenario. So for the ACA Code of Ethics, Section A4B deals with personal values, and it says that counselors are aware of and avoid imposing their own values, attitudes, and beliefs and behavior. Counselors should respect the diversity of the client and the trainees, and they should minimize the risk of imposing their values upon clients, especially when the counselor's values are inconsistent with the client's goals. Also, ACA Code of Ethics I-1B deals with ethical decision making. And it says when counselors are faced with ethical dilemmas, they should use and document as appropriate ethical decision making model that includes but not limited to consultation, consideration of relevant ethical standards, principles, and laws, and then the generation of a potential course of action, which we are doing here. Furthermore, in Alabama Code of Ethics 2016, Section A1C deals with counseling plans, says that counselor professionals with their clients should work jointly to create a plan and offer reasonable promise of success, and the counselor should regularly review the plan. Also, in the Alabama Code of Ethics, C2A deals with boundaries and competence, saying that licensed counselor professionals should only practice within their boundaries of competence based on their education, training, and supervised experience on state and national levels. Step three, nature and dissemination. Autonomy, justice, and beneficence are three things that I believe can be displayed throughout this scenario. So, autonomy addresses respect for independence and self-determination. David has struggled to find the perfect counselor for him. He feels as though no one understands him or his circumstances, but despite that, he kept searching until he found the correct counselor for him, which appears to be John. Second principle is justice, as cited in Forrester and Miller's 2016. Justice treats equals equally and unequals unequally, but in proportion to their relevant differences. Until this point, David has been served an injustice. He has been a victim, and he plans to try to recover from this injustice by meeting with John, and John also plans to help him through all the situations based on his experiences and training. Then lastly, is beneficent. So John intends to utilize his training to help him, which is beneficent as it relates to the counselor's responsibility to contribute to the client's welfare. To help me with this situation, I would speak with Dr. Kelsey Wilson. She has a LPC and she works for the Life Care Wellness here in Tuscaloosa, and she practices mental health counseling. Also, Sam Franklin, who works with River Oaks Health in Tuscaloosa, he specializes in substance abuse. Two organizations that I would get to help me on the state level are Bradford Health Services and Indian Rivers Behavioral System. Bradford Health Services is an inpatient addiction treatment center that is committed to helping those affected by alcohol and drug addiction heal their mind, body, and spirit. And they also offer 24/7 guidance, support, and personalized care through their 12-step program, which gives a lasting recovery foundation. Also, Indian Rivers is a behavioral health that deals with outpatient services in mental health and substance abuse. They try to provide a comprehensive and rich continuum of mental illness, substance abuse, and developmental disabilities, and they want to create a treatment plan that is centered on the client to help their needs and make sure that they have the proper skills and network needed to maintain their success. There are three different potential courses of action that deal with therapy. One is cognitive behavioral therapy, which uses one-on-one sessions with the mental health counselor, experiential therapy, which is a hands-on counseling, and then dialectical behavior therapy, which equips the client to manage their emotions in the moment and improve relationships so that they can resolve conflicts and handle stress. I believe that John will help David through two of these integrated therapies, and we will talk about those on the next slide. So, when it comes to the potential consequences, there are positives and negatives. So, for each of the following, I have created a table of positive and negatives. So, with cognitive behavioral therapy, the negatives include emotional discomfort, potential for dependence or a big time commitment, but the positives are increased self-awareness, greater sense of control, and improved coping skills. With experiential therapy, there are negative consequences such as the risk of false memories, worsening symptoms of anxiety or depression, as well as cultural sensitivity. However, on the positive aspect, there is a resolution of trauma and conflicts, stronger relationships, and creative expression and problem solving. Lastly, on dialectical behavior therapy, there are negative consequences such as complexity, group settings, and ethical concerns. However, on the positive side, it gives a decrease of substance abuse, improved emotional regulation, and enhanced distress tolerance. So, regarding these, I believe that dialectical behavior therapy as well as experiential therapy are the best for David, and they can be used and integrated to help him. Both of these therapies have been proven to be effective for clients with substance abuse and misuse disorders, and the consequences of positivity outweigh the negative. So, David will be able to have a hands-on counseling experience that will equip him to manage his emotions in the moment, improve his relationships, resolve conflicts, and handle stress by exploring his thoughts and feelings through art, music, creative writing, and or adventures. So Forrester and Miller also have these three tests that deals with the code of ethics: justice, plurality, and universality. So the test of justice assesses the counselor's sense of fairness by determining whether the counselor would treat the others with the same situation and it be fair to both parties. So in this case, it would be both David and John. With publicity, it assesses the counselor's behavior if it was reported to the press or posted on social media. Would the counselor be confident and comfortable by standing by their action? And then lastly, with universality, it assesses whether the counselor would recommend the same course of action to another counselor in the same situation. I would say yes, that my course of action provides um, or meets the test of each one of these, and the behavioral therapy and the experiential therapy passage each one of these tests. So lastly is implementation. So how can we implement this for David to be able to go through counseling and be successful? So first, you need to create a safe and supportive environment. So establish a space where clients feel comfortable and explore their emotions without judgment. Two, choose an appropriate activity. So whether it be music, drawing, writing, psychodrama, or adventure, whichever therapy he chooses, let us do that. Also, we need to facilitate emotional expression. So, encourage the client to express their feelings through the chosen activity and allow them to experience emotions in the present moment. David uses drugs and alcohol to escape his emotions, so having this exercise will be perfect for him. Guide clients to reflect on their experience, connect with their emotions, and gain a deeper understanding of what is going on. Integrate learning, help clients translate their insights gained from day-to-day use and help them use that as a coping mechanism to promote a lasting change. Utilize creative expression. So earlier we talked about role playing, psychodrama, music, poetry, writing, any of the arts. So use that to explore who you are and how does it make you feel. If there's a art or expression that was chosen earlier that does not work now, feel free to change so that we don't do any more damage or harm to the client. Consider family dynamics. In therapy, experimental techniques can help clients, excuse me, understand their others' emotions, improve communication, and resolve conflict. And then lastly, as a therapist, it is our goal to make sure that clients are able to process their information. And so we do this through continuous guidance and support and reflection. Okay. Thank you so much for listening to my presentation. I have attached my references, and I hope you have a great day.